Hello, I'm Dr. Jimmy Hang. I am a clinical orthopedic physical therapist specialized in sports medicine, and I'm here to talk to you about what makes up the IT band and what exercises you could do to help relieve the symptom after a long run or training for a marathon. And the iliotibial band, or the IT band for short, is one of the most common injuries for runners. And as you could come see here, come on this way, and what consists of the IT band or the two muscles. One is the TFL and the gluteus maximus, and they're located around the pelvic area. One is more so of the flexion and internal rotation of your pelvis. The other one, the gluteus maximus, is the external rotator. So where it locates is the IT band, or the iliotibial band, is a tendon sheath actually that inserts into your femur lateral epicondyle, and it fans out into a tendon sheath into the lateral part of your kneecap, your patella, and the distal, or the bottom end, inserts to the tibia tubercle. So it's like almost like this type of shape, like a fan shape. So the reason why people have IT band syndrome, we call it, is due to overcompensation of your TFL muscle, because it acts as an internal rotation of your pelvis or your hip. And this is because due to the lack of strength or the weakness of the gluteus maximus, gluteus medius, gemellus, all those external rotators of your pelvic, and also some of the overcompensation of your hamstrings and some weakness of the hamstring as well too. So during running, when someone runs during the swing phase, as they pick up their knee, typically through the flexion of the knee, what happens is your femur supposedly external rotates and your tibia internal rotates. And because of this overcompensation, it causes tension in this IT band, because when it tenses, the TFL fires and it rotates inwards. And due to that rotation and counter force of the femur that's supposed to rotate out, this causes it to rotate in. It causes increased tension of the IT band. So it causes rubbing every time you flex the knee, like so. Okay? Now if you strengthen the hamstrings, release some of the tension in your TFL. I'm sorry, not only hamstrings, but the gluteus maximus, medius, all the external rotators. Then it helps to stabilize the pelvic girdle and your muscles much more readily, so it has less tendency to rotate the hip inwards and causing tension in the IT band, so it doesn't rub as freely over the lateral epicondyle of your femur. So with that said, I hope you understand some of the reason behind the IT band syndrome, and it's due to muscle imbalance, overcompensation issues, and that's something that us physical therapists could help you with. And the next clip of exercises that will help relieve some of the tension you have in your TFL, and some of the neuromuscular type of exercise that you could help with your joint in your knee as well. Thank you for watching. I hope you subscribe to our channel. I'm going to help you find the tensor fascia lata muscle. With your right hand, place it over your right pelvis, over your most bony prominence, or bony feel into your fingers, and go down about an inch towards your knee. And with your other hand, you help support and grab hold of the muscle. And the way to confirm if you're on the tensor fascia lata is you slowly rotate your hips inwards, and you should feel that muscle belly popping into your fingers. And as you do that, holding that pressure down, you could rotate your pelvis outward, and as well as gently apply some muscle tension release over the tensor fascia lata. You're gliding it down along the muscle fibers of the tensor fascia, and band, relieve some of the pressure. And when you're rotating your hips outwards, it also allows your glute medius, glute maximus to take effect of the motion while you're applying tension release to the tensor fascia lata. And with two hands, you grab hold of your knee, and we're going toward the IT band insertion, and with your thumb to the lateral side of your kneecap or your patella, and with your palm of your right hand, you apply pressure towards your hamstring or back of your thigh, and you bend your knee as you hold the IT band down as you bend the knee. And while you're doing this, you're allowing the IT band to not rotate over the epicondyle as you bend your knee. And this helps condition for runners into their swing phase of gait. And as they pick up their knee, they swing, their IT band rubs over, cause friction to epicondyle. And this will allow the neuromuscular conditioning of the IT band not rubbing over the epicondyle. And you should do this periodically every hour for a couple days and rest in between running regimen, and should feel some immediate relief. If you're not feeling better, come see us here at Total Body Center. Thank you for watching.